Hello? Hi. Yeah, sorry, I've got really bad signal here. Can I call you after? Okay. Okay, thanks. Bye. Bye.
Hi Tina, I'm
Hi.
Mel. I'm one of the health advisors here.
Hi.
And I'm just seeing you following your diagnosis of TB or trichomonas.
Yeah.
What do you make of that? I know you were here last week. What do you make of having the infection back again?
I got it again, so I need to get it treated.
And what's your thoughts on why it's back again now?
Well, I don't know, but I'm back here again, so I come to the clinic, so that's a good thing.
Yeah, that's a really, really good thing. So thank you for coming back today. I know when we spoke last week, we talked about a couple of partners that you see, and you'd said that it was really difficult for you to contact them.
Yeah.
And I'm just wondering how that went, or if it wasn't possible.
I can't talk to them.
Yeah.
There's no way that I can do it.
Right, it's just really difficult.
Yeah.
And are those people that you still see and have a sexual relationship with, or?
Mhm. Sometimes.
Sometimes, okay. Are you? I know you're looking at your phone. Are you okay to talk now, or would you rather?
Yeah, no, I'm fine. I'm fine.
Okay, okay. And you said there are people that you still see sometimes, so they're not regular partners, but they're still people that you have some kind of relationship with, and you said very clearly that they're not people that you can talk to yourself. I'm just wondering, for some patients it's helpful for us to contact those people, but keeping your name out of it.
Can you do that?
Yeah, we can do that, and we would ring them, say who we are, say they may have been in contact with infection, but we don't mention your name. So you're kept out of that.
Okay. Yeah, if you could do that.
Yeah, we could certainly do that for you, and I can take the details.
I think I've got their numbers.
Ah,
yeah, no.
brilliant.
I can do that.
Okay, fantastic. Okay, that's great. Thanks for giving me that information, Tina. And as I say, just to reassure you, your name will be completely...
I won't be mentioned at all.
You won't be mentioned at all.
Okay.
We've also talked about the infection and when not to have sex, and I said I'd follow you, speak to you again in a week's time.
Mhm.
I guess I was just looking through your sexual history, and I know that usually you don't wear condoms when you have sex.
They're horrible.
They're horrible.
No one. I mean, no one carries them around anymore. No one. I mean, even if like you go to buy them, you get a funny look from like everyone because you're buying condoms, and so you get judged for it, and they're really uncomfortable. So don't really bother.
So it seems to you that actually it's not something that anybody else does these days, and
not really, no.
And it feels like something quite difficult to buy because of the looks and that you get from people when you do that.
Definitely.
Yeah. So they're the negatives, I guess, against using condoms. And what about the other side? Is there any downside to you of not using them? Anything that concerns you, or?
I don't know. Well, I have to keep coming here. I normally get like the morning after pill, like loads. So yeah, I suppose I have to like make that effort. But I mean, I don't know. Maybe if I was on something like different, like the pill or something, I wouldn't have to keep coming here.
And is that something that you've thought about and that you'd like to do, or?
I don't know. I don't really know enough about it.
Right. And is that something that you'd like us to talk about today, or?
Don't know. Maybe.
Okay. I mean, we can do that. If that's, we can use this time however you want. We can talk about forms of contraception. We can talk about what makes it difficult to use condoms. So it sounds like you said it was difficult coming here, but otherwise you've got emergency contraception, which is great. And the infection side of things, you said that bothers you a bit, but you come and get treatment.
Yeah, I always get treatment.
You always get treatment. So if I was it goes, yeah. And if I was to say to you on a scale of 0 to 10, how important it was for you not to get another infection, if 0 is not at all important and 10 is, yeah, it really bothers me, it's really important.
It's not really important because I get treatment for it, so and I know when I have it, so
yeah. So what score would you give yourself on that? Low down score?
Like
or?
One, two, maybe.
Okay, so it's really not that important to you at all at the moment.
Not really, no.
And if I was to ask you another question about condoms, if I was to ask you how confident you feel that you could use condoms if you made that decision. No. So again, that sounds like a low score. And what would need to happen for that score to change? What would need to happen for it to be more important to you?
I don't really know. Not a lot at the moment.
Yeah, it's just not something.
It's not something
that matters to you right now. And as you say, you come to the clinic, which is really good. And I guess I was wondering when you spoke about that, because although a hassle, it's something you're really good about doing, coming and getting treatment, as you say, getting the morning after pill if you need it.
Yeah.
So you take care of those things. And I just wondered how you'd feel about maybe coming to the clinic every 6 months for a sexual health checkup, so we can.
Well, I come here already.
For treatment, you mean? Or?
Yeah. So, would I need to come here that much?
I guess it's entirely up to you. You know, the decision is yours. But I guess one thing that we discuss with people who choosing not to use condoms at this time is coming for a checkup every 6 months, so that if you had an infection, we could pick it up and treat it.
Wouldn't I be able to tell anyway, though?
You mean you're thinking wouldn't you know if you had an infection? Yeah. Unfortunately, with a lot of infections, you wouldn't know. So I don't know if you've heard of something called chlamydia.
Yeah.
Yeah. So the majority of women with chlamydia won't actually know they've got an infection, so they won't know to come and get that treatment.
Oh.
And chlamydia is something that we can pick up from screening, and we can treat for people.
Okay.
So to get
I might think about it then.
Yeah, as I say, it's entirely up to you. It's just something I thought I'd mention, because you do make the effort to come to the clinic.
Yeah.
Is there anything else you wanted to ask me today or talk about today?
No, not really, no. I might think about it.
Yeah.
Then, yeah.
Okay.